The Nigerian Medical Association some weeks ago, precisely on the 2nd of July 2025, issued a 21-day ultimatum to the federal government over what it called unfavourable allowances, a warning that could lead to a nationwide doctors' strike. The NMA is demanding the withdrawal of a controversial circular issued by the National Salaries, Incomes and Wages Commission. They say it violates past agreements and worsens the already dire conditions for medical professionals.
The bone of contention, you ask? Here it is. There was a circular dated June 27, 2025, which attempts to revise allowances under the Consolidated Medical Salary Structure, CONMESS, but the NMA says it's misleading, inadequate, and a breach of collective bargaining agreements from 2001, 2009, 2014, and 2021. And they're not just upset about the numbers. The NMA claims that they weren't consulted at all. They had submitted corrected adjustment tables, but those were ignored. Instead, the government issued a unilateral circular that that the doctors say doesn't reflect economic realities. Joining us for today's discussion is the first Vice President of the Nigerian Medical Association, Dr. Benjamin Olowojebutu. Good morning. Thank you very much for joining us.
Thank you very much. Good morning, Benjamin. How are you? Good morning.
Good morning. Good to have you here. Let's go back to this June 27 article that is causing an issue. Talk to us about, the process. You say that the government did not consult you, and you say that the government hasn't, upheld its own end of the agreement. So talk us through why it's an issue.
So every time there's an increment in salaries, there's what we call collective bargaining agreement, CBA, that is going to set up between an employer and an employee. So in government, government brings the professional association together and have a discussion. So since 2001, there has been a particular CBA that has not even been followed since that time because they've been shuffling our salaries, as the case may be. So this particular one, we now requested, before the circular came out on 27th of June, we had calculated properly what it should be with the agreement we had originally in 2001, 2009, 2014, and sent it to this National Income and Salary Wages Commission. We're thinking that we're going to have like a bargaining, like a meeting, but nobody called us for a meeting, and just on their own sat down in their offices, did their own kind of mathematics, and just give us something just like that. Nobody does that in the world. Even international labor law talks about you having a discussion with your employee. I'm sure you guys can't have the same salary for the past like 15 years. No, there has to be a bargaining, and this commission has failed to give us an opportunity to have a discussion, and that's very, very wrong of them.
Have you raised these issues with them, and what are the consequences of them not listening to you? We have raised that. That's why we have the 21-day ultimatum, and we're thinking this is 6 days to the end of the 21-day ultimatum. We've not really seen anything from them. The first thing we ask them to do, importantly, is to withdraw that circular. It's misleading, it's insensitive, it's very, very, very inappropriate, it lacks credibility. First thing you should do as a sincere commission of government is we apologize to you, NMA. We take back this wrong circular, but nobody has spoken to us at that time. And we're just waiting this 6 days to the end, and we cannot guarantee industrial harmony after 21 days. That's how it's going to be.
So the circular shared by the federal government, can you share with us what it actually highlights? Is it beneficial? If yes,
it is not beneficial because normally there's an agreement.
Okay.
If you don't go with the agreement, how can it be beneficial? So okay. It's far from being normal. It's abysmal. That's what to use, because if someone just sits down and says, if you're supposed to get like 100% increase in your salary, in your allowances, somebody gives you 1.7%. Look at 100, look at 1.7%. We're not even asking for an increment.
Is that what they're saying?
Yes, no,
1.7%.
Yes, just obey the CBA, the agreement. Just obey it. If you obey the agreement properly, the salary will naturally just increase on its own because there's an agreement already. But you sat down, you didn't obey the agreement, you just sat down and said, okay, no, this is what I feel that these doctors deserve. Give them 1.7%. Who does that now? With the kind of work we do in this country, the kind of overload work, condition. You have one doctor to about 10,000 patients now. Nobody thinks about how we live, how we help our families. Some people have not gotten their MRTF allowances in the last 1 year, and they are doing residency in this country with a lot of stress, Who does that now? And you just sit in your office because you have very good air condition, or maybe you have a very posh office and say, this is what these doctors deserve. Just take it. No, it won't happen again in this country.
Yeah, but Dr. Job said those that will argue that, you know, doctors are not the only ones that are complaining. The military personnel complain about work conditions and what have you, ASU, you also have the teachers. So there's a myriad of problems across the country, so you can't be treated specially. They also argue that you took the Hippocratic oath to serve the people. So why are you complaining now? And why do you threaten industrial strike? Your industrial strike is a life and death matter at the shortest notice. How do you respond to?
Wenga, you know us now. Alice, you know me, you know a few of us. You've met us a couple of work, and you know how passionate about this country. How few of us have stayed back and said, no, we can't leave. Even with the opportunity to leave this country, we have said, no, we're going to stay in this country. But you can't, we are human beings. We have livelihood. We have things to do with our lives. We have families to take care of. We have things. We have ideas. We have career progressions to do. But you can't say because we have signed an oath, we should be hungry. We should die. We have lost a couple of friends doing ward round in the office. We have lost a couple of doctors just dying because of overworked, having chronic diseases that they cannot afford to even take care of themselves. So who does that and says, okay, because I want to labor for the country, I should die doing that? Nobody does that now.
Do you feel like this new circular that has been put out, the June 27 circular, feels like salt, adding salt to injuries, coming off the back of the St. Lucia deal that was criticized as well by the NMA?
It is more than so, like pepper, adding pepper to injury. So you just demean people. You look at these noble guys that are doing this work. We have over 230 million Nigerians. You have barely 30,000 doctors serving them. Right. And you think these doctors don't deserve good life? No,
right, hold that thought.
Think about it.
I want us to also speak about the NMA's position regarding the St. Lucia deal, because whether we like it or not, collectively as a body, they may criticize it. But there are some doctors who will be excited about the opportunity to be posted abroad. But we'll go on a very quick break, and when we come back, we'll tell you more about that. Welcome back to Breakfast Central. We're still looking at the Nigerian National Medical Association and their complaints to the federal government, especially regarding the June 27 circular. And we have the first vice president of the NMA here with us, Dr. Benjamin Olowojebutu. Thank you very much for staying with us. I want us to speak about the St. Lucia deal because it sparked a lot of conversation on social media, outrage from a number of Nigerians. Even the NMA publicly criticized the decision to host medical personnel to St. Lucia. However, there are some doctors who will be excited at the opportunity because they go to St. Lucia, they earn approximately 40 million, whereas if they stay back, they're earning, I think, roughly 11 million, thereabouts. So what are your thoughts on the St. Lucia deal?
I think it's wrong timing. I think it's very unfair to Nigerians. Can I shock you? St. Lucia has about one population, 180,000 people population. That's like a Longo in Kano, or like a street in Agege. So you leave 230 million people that has 30,000 medical doctors to leave to St. Lucia that has just 180,000. What is the rationale? What is the mathematics? What is the compassion value that you leave your country that needs this high-tech, passionate medical doctors, medical service, and say you want to go to and serve 180,000 because of political gain or relevance or because of kind of diplomatic ties.
Yeah.
Now, if you say you want to take them in, that's fine, that's what I think, but pay the doctors that are working in Nigeria. That's the money you're going to pay Nigerian doctors that are going to go and work there for 2 years. That's about 40 million. So if you say baseline, if you say you're paying them 3 million every month, that should be the same baseline you pay the doctors that are going to work here, that are going to serve 230 million people in rural communities, and these doctors that are dying almost every day. Doctors now do calls, some doctors do calls for 30 days in a month. That means they don't go home. They live permanently in the hospital. Why? Because the hands are not plenty.
And what's the current doctor-to-patient ratio?
1 to 10,000.
What is the required?
1 to 600.
My goodness.
So there's a huge deficit.
So it means for me that government is not taking Nigerians seriously. They are not taking us as doctors. So they just think because we signed a Hippocratic oath, we should be dumb, we should be foolish, we just work and die. Can I shock you? Most doctors cannot even buy a proper car for themselves anymore because inflation has, imagine the salaries you earned 10 years ago is what you're still earning now. The last time we had a collective bargaining agreement was 2014, 11 years ago.
Can you share with us what's the salary structure of a doctor? I mean, just looking at it monthly on the average.
The lowest doctor now is about 250,000. That's house officers.
320?
250,000 naira.
250.
Yes, that's like the lowest cadre of doctors on the cadre. Highest doctor is about maybe about 1.5 million naira every month. A professor. Okay. So look at how long it took you to become a professor, and the people that you have trained, and that's what you earn every month.
So if we do 250,000 naira earned by a doctor times 12, that's about 3 million naira in a year.
In a year.
3 million naira will not buy you a Toyota Corolla.
It will not buy you a food.
It will even pay your rent in a very good area.
Correct.
Because 2-bedroom now in a very good area, and doctors need to sleep properly, rest well, take care of themselves.
You're a good man. You're a good man. If you help us have this kind of conversation, I think what we need now is that all of us as Nigerians, let's start talking about these conversations. Help us make Nigerians see us seriously and make government seriously, because we're dying.
But talking about conversations, the current Minister of Health, Professor Mohammed Ali Pate, is said to be a man with the listening ear. He knows the issues. Can you talk to us about your engagements with the Federal Ministry of Health? How hands-on are they about fixing these issues? Because, I mean, you look at UCH, look at the teaching hospitals, it's a sorry case. You almost think our leaders not embarrassed about the state of healthcare in their own country, because that is one of the basic things you need to sustain life.
I like that question. Are our leaders not embarrassed? Are they embarrassed? No, I don't think so. Because taxpayers' money just goes to their pockets. Nobody's accountable for anything. So, talking about the Minister of Health, he's trying. But, a lot of things needs to be done very, very locally. Local content, local ideas, things that work for us in Nigeria. Understand the cultural deficiency that we have in this country. You can't just bring ideas that are very, very, very good, maybe that works in better climate in America and in London, in the UK or in Russia, everywhere, and say it will work in Nigeria. No, there must be understanding of the local policies, local content. How does this benefit Nigerians? How are the doctors working extra hard? For example, how do you know? I asked myself, does the minister understand that there's one guy in Kafanchan that works every day from Monday to Saturday to Sunday, then to Monday? I have friends that don't even see their family, don't even see their children for weeks, working for Nigerian, working tirelessly.
And no one should even, regardless of the medical field, no one should work in those conditions. Yes.
So you think people that are in government should think like that, but they don't think like that. They think it's your duty to work and you die. And guess what? When you die, that is all. Nobody remembers your family. There's no insurance. There's no support. You just die. And I thought of myself, the way we celebrated President Buhari's death, that's what we should celebrate when a doctor dies in this country. Because when one doctor dies, that means you've lost a doctor that will see 10,000 patients. So you should bury them with a lot of dignity, love. But you see what? Because somebody can sit down and say, I have ear pain, I can jet out to America. I can jet out to France.
I was just about to come to that, because you now mentioned former President Muhammadu Buhari, who's just passed. And one of the conversations that his passing has sparked is the fact that he passed in the hospital in London, and that has now also exposed the acts that politicians have any slight illness. We saw that with President Muhammadu Buhari when he used to go abroad for dental checks. President Tinubu has been traveling a lot, even though they call it a working, vacation. So let's talk about that. The thought of the NMA, your thoughts about the frequent travels and the fact that medical tourism seems to be something that is encouraged by our political class.
I think it is not love for country. It's not patriotic enough to not fix your country and go spend the money of those that help you pay taxes in another clime. The amount of money that is spent on in those trips, you cannot quantify them. The extra code you collect, the kind of money you spend on those. And can I shock you? most of the doctors treating them in those places are Nigerians. I know a lot of them that tell me, that gives us a story back end. And the guys there, even they are sorry that you leave the best guys in this country, the best guys in Nigeria. They know the best technical guys, passionate guys that understand, that spend their personal money furthering their training outside the country. They are here. Sacrifices. They are saying that we have opportunity to live abroad, but no, we want to stay in this country. You know why? Because we believe that there are researches that we can do in this country that are peculiar to Africans. Some drugs we'll take that is peculiar to the Western guys might not necessarily work for Nigerians or work for Africans. But when we have continuous research about how our bodies, how our genetic makeup is, it will make us improve the quality of life of people living in this country. But I'm very, very dismayed. I'm very, very unhappy. It pains me that people don't see what we see, because very soon, in the next few years, medicine and study will go into extinction. Nobody wants to be a doctor again, because you know why? There's no future to see.
And it seems there's no state of emergency that has been declared on the medical sector. I saw a video on social media yesterday, a picture of a young boy that was brought into the emergency ward. You could see it was, they were trying to refer him to another hospital. They had to put him on a drip on the visitors waiting bench. That used to be the star hospital in the whole of Africa. You had doctors from all over the world coming to UCH Ibadan, and we've seen the decline. Students had to go on strike. The Minister of Health Power had to be embarrassed to fix that situation. You need to, let's not even talk about the living conditions of these doctors. So as a member of the NMA and as somebody who is, you're very hands-on, you've seen the decay in the health sector firsthand, and looking at the whole of the problems. I mean, it's almost the problems every step of it.
Every step.
Where do you begin to fix things? And can we get back to the glory days? Because we're not reinventing the wheels. We've been there before, of Nigeria being a health powerhouse.
Well, first, I think there was a collective understanding of that Nigerian dream, if there's one again, that the government should be willing to show love to the people they serve. Number two, I think health should leave the concurrent list and go to the exclusive list. Because you have the kind of money you spend on ammunition in this country, the kind of money they spend on, even though we don't see but because it's on the exclusive list, there's a legal backing to spend that kind of money. But health is on the concurrent list, so there's no legal backing to spend a lot of money on healthcare, and there are no accountability. You can see that so
you just wait for the budget, and
yes. So the budget, not even adequate enough, but because it's concurrent, you say, okay, some states can do this, some can do this. But if it is an exclusive list, the federal government has the sole capacity to fix this country health-wise. If they love the people genuinely, I'm not asking people alone to say, what can you do for Nigeria yourself? I think there should be a law that says no politician in the first 5 years should leave the country for health, for medical tourism. If you want to do well, fix your country. I was telling people, somebody else, I said, Jimmy Carter died, he died in America. Nelson Mandela Great died in Joburg.
Professor Jonathan Mills of Ghana
died in Ghana. Jerry Rawlings died in Ghana. So why do we enjoy dying abroad as president?
Sorry, because of time, I just need to ask this question. I think we're out of time. 300 dentistry students risk expulsion in Unical. I know you've been following that story as well. And then lastly, do you think you should get private investors to also support the medical system?
I think so.
Because I've been talking about Dangote, Elumelu. I know I had a guest fight me over that and said it shouldn't be, but he's not a medical person.
Yes. So first things first, the Unical students, I think it's wrong for the university to have admitted them and say they cannot graduate. I think it's wrong. We're already working on it back end, because you cannot. You love the student now, they're having risks of suicidal already, because they want it doesn't make sense spending from 2017 till now and say you cannot graduate. That doesn't make sense. We'll try to fix that. We're doing back end, talking to MDC and talking to the university, and so we can work that out immediately. But as I've said, there must be investment. So investment in healthcare is not necessarily about profit immediately. I think a lot of our private investors want about immediate profit. You know that they're going to oil and gas because there's money immediately into banking. But healthcare is about social service. How do you see people treat your life, your community? For example, you cannot say because you are very, very, very a billionaire and you can go abroad. If you think about 1% of those in your community that can never afford to see a doctor, you want to invest in healthcare and just make it like, okay, this is my own CSR to the people. And I believe that putting this money into this investment will make people pray for me, and my life can be long again.
Right.
You know,
if your demands are not met in 21 days, what next? In 30 seconds.
We cannot guarantee industrial harmony in this country in next 6 days. That I know, because we're going to have an emergency general meeting that we're going to take another course for direction. I believe if we have a listening government, they should have called us now 17 days after we demanded it. We had meetings with DSS, we had meetings with Ministry of Health, and we've not had proper meetings with those that matter. First things first, it's very simple. Just withdraw that scrupulous circular. It's common sense now, but nobody's listening to us, so we'll see.
I mean, that's why we have this platform, to give the NMA a chance to air its grievance, and we hope that it can come to a negotiating table with the government, and the government listens, because they're a very critical part of Nigeria's, healthcare, Nigeria's healthcare infrastructure. We don't want people going to the hospitals and not being able to get access to medical intervention because they're on strike. Nigerians deserve better than that. Thank you very much for joining us.
Thank you, Ellen.
On a much lighter note, Lagbaja saw the importance of doctors, and he talked about the sacrifice in 1996,
yes,
when his hand baby, Nico,
the
sacrifices people made.
Thank you very much for saying that.
And your spouses as well.
Help us talk to people. Thank you.
Thank you for joining us.
Thank you,